There we go. How's that?
Yeah, excellent, fantastic. You can get started.
Okay. I'm not the most tech savvy, so sorry about that. All right, assalamu alaikum everybody. I'm going to be talking a bit about the recruitment side of applying for pediatric training. So first and foremost, a little bit about me. My name is Huda Khalif. I graduated from St. George's University of London back in 2018. And then I did my F1 and F2 in Leicester. And I'm now going to be starting in September as a pediatric ST1 in the Northwest London Deanery, alhamdulillah. So yeah, that's a bit about me. I wrote me in capital letters because, you know, it's all about me. I'm joking. But yeah, that's all I have to really say about myself. We have a lot to get through today and not that much time. So I'm going to try to zoom through it as much as possible and leave time at the end for questions. But I'm also going to be like leaving you guys with a lot of resources so that anything that I do share, you can find out quite easily for yourselves. So this is what we're going to be discussing today. So overview of the structure of recruitment, the actual process of the application, then the written application itself, the interview, and then the resources that I was just mentioning. So let's just get straight into it. So in terms of the disclaimer, all the information that I'm using is based on the 2022 application. So everything that they did for our application and everything that's on the Royal College website for 2022. So there might be some changes. For example, between 2021 and 22, there was quite a few changes. In 2021, they used the MSRA exam, and in 2022, there was no MSRA exam. And for example, I don't know if they will continue with the online interviewing format, but for the moment, we'll go on the information that we do have and just keep up to date with the Royal College website for up-to-date information in regards to the recruitment process. So let's go straight into it. The structure of recruitment. So the first thing that you have to do is there's an application form, and it's a written application form. Unlike other specialities, you actually have to write things in the application form. It's not just a form on Oriel where you just fill out your personal details. So it's on Oriel, just like everything else. There's white space questions, which means there's a couple of questions where you have to write quite a bit of information. And this is to cover things like your past achievements, clinical experience, governance, and career motivation. And they then score your application from the white space answers. Then the rest of your total application is made up with your interview. So this year it was a 30-minute online interview covering communication, clinical reasoning, career motivation, and reflective practice. And then they collate the scores from both the application form and the interview, with the interview weighted more heavily together. And then that basically forms your national ranking score. So that's the overall sort of structure of recruitment. So we'll go into it in a bit more depth. Now, let's talk a bit about the actual application process and Oriel. So you apply through Oriel. Some of you who have done the foundation program already within the UK would have already used Oriel and have had some sort of experience with it. Others won't have, but don't worry, it's quite self-explanatory. The only thing that I would say is I'd advise that you, prior to the application window opening, make an account ahead of time and just play around with it, become a bit more comfortable with it. The application window is normally between the beginning of November to the beginning of December. Then after the application window closes in the beginning of December, there's the long listing period. So for the long listing, it's basically making sure that you as an applicant actually meet all the essential criteria that's outlined in the person specification. Don't worry, I'll tell you guys what that is in a bit. But basically what is there for is to make sure that you're actually at the right stage to be applying for pediatric training. It's as long as you've got all those sort of essential boxes ticked, you'll be fine. I think most people get long listed. Then that's normally done within the month, so within December. By the way, these dates are all rough. It's based on how it was last year and the year before. And then after that, you have the shortlisting, which is done by sometime in January. Now, the shortlisting is basically your application score I'm going to go into a bit more detail about what that will entail. But basically, your written application will be given a score. There's a minimum sort of cutoff, so you have to meet the cutoff. And then beyond that, depending on sort of how many applicants that they have, the cutoff will be higher or lower. So if they've got like a lot of applicants and they don't have the capacity to interview everyone, then there will be a high sort of cutoff, and you'll be invited to interview based on you meeting that cutoff. Okay. So, but don't worry, we'll talk about how you can, accrue points for the shortlisting and, guarantee yourself an interview. And then you have your interviewing period, which is between about February and March. And then afterwards, you have your preferencing deadline. So your preferencing deadline starts more or less quite early in January or December, and you can preference all the way up to the day before offers are released. So you have quite some time. And then offers are released, and then you have your deadline to either upgrade or accept or decline or whatever you want to do, basically. Just a bit about preferencing. So with preferencing, that's when you're choosing the order of the list of deaneries you're willing to work in. They always say, don't list somewhere you're not willing to go to. Like, I'm not willing to go to the Highlands of Scotland, so there's no point in me putting it in my list. And there are a lot of jobs. So listing all of them is absolute, is a headache, right? So what I did is I went through the areas that I was willing to live in, and then from each one, I preferenced it in order of like the ones I wanted the most, go and so on and so forth. I was a bit pedantic. I was only willing to live in very specific areas. So I only ranked like 100 jobs. But yeah, how much you're willing to rank is up to you. And then your offer is given based on your national ranking and your preferences. So basically what happens is you've got your national ranking. The first ranked person gets their first choice. Then the second ranked person gets their first choice if it's available. If it's taken, they get their second choice. And it sort of goes on like that, right? And that's how you end up with your offer, basically. I hope that makes sense. Moving on. So when you do receive your offer, you have 48 hours basically to decide what to do with that offer. What offers are often given towards the end of March. You can either accept the offer straight away, you can accept with upgrades, which basically means that you're accepting the offer, but in the next 2 weeks, if another job that was higher up in your ranking becomes available because somebody didn't take it, then you automatically get your offer gets moved to the other one, and then you automatically accept the upgrade. That's what happens. You can just hold on to it, and people hold on to it if they have like other specialities they've applied for, and they're like not quite sure which way they want to go. So you can hold on to it for a certain period of time until you have to make a decision, or you can of course decline. I hope that makes sense. I'm moving really fast. There's actually quite a lot to cover, but if you have any questions, just please write down as I'm going along. Okie dokie. So this is the bit I want to spend a bit more time on. The actual written application form, right? So I'm going to go through each component of the application form, and then I'm going to also go through how you can prepare for it. Okay. So the application form is made up of 9 sort of white space questions. Okay. The first one is additional qualifications. That's out of 3. So that's like, okay, we've all got medical degrees. What else do you have outside? Have you got a BSc? Have you intercalated? So you've got a BSc. Have you got a master's? And I think if you've got a PhD, that's a point as well. So depending on what you have, you can get some extra points out of 3. The second one is if you've done any of the PEDS exams. So if you've done 1 or 2 of the PEDS exams, you get 1 point. If you've done more than 2 of the PEDS exams, you get 2 points. And then, so those are quite straightforward yes and no questions. Then the other ones, you actually have to write quite a lot. So there's a question on your transferable clinical skills. There's a question on, and it's out of 4 marks. There's a question on transferable clinical experience and, how you reflected on it. There's a question on, any quality improvement or audit sort of projects that you've been involved with. And of course, it has to be relevant to your application level and experience. So don't worry, you're not expected to have done, what a consultant might have done in their whole lifetime of a career, but something that you can talk about, and you say, I've learned this and that from it. The whole point of it is that you've done something and you're able to reflect from it. And then there's leadership and management relevant to the application level and experience. That's out of 3 marks. There's academic achievement, and then there's teaching, and there's just teaching, basically. So all of the ones I've just listed there, from what I remember, it was like a 400 word, what was it, character? 400 words. It was like a paragraph, basically, right? That you had to do for each one. And then the last one is statement demonstrating your suitability for a career in pediatrics. Basically, why would you make a good pediatrician? That's what the question is. That one you're expected to write about 600 words, and it's worth 6 marks as well. So it's quite a lot, basically, they expect you to write in the application form. Out of all the other specialties from my friends who I've spoken to, it sounds like peds might be the only specialty that does this. So that's why a lot of weighting is given to it, because this is basically your portfolio now. You're putting down everything that's good about you that you can think of, medical, non-medical, anything that you think that can fit and you can make it fit, you put it in here, right? And the way it's marked is there's 2 assessors that assess your application separately, and so there's a maximum, if you count all of the marks that I've written there, there's a maximum of 33 marks you can get from the actual questions. So one assessor can give you a maximum of 33, the other assessor can give you a maximum of 33, and so that adds up to, you can get a maximum score of 66. So what can actually happen is one assessor, might think one question you're a 2 out of 4, another might think you're a 3 out of 4, for example. And I guess it's just to make it a bit more fair. So that's how it works. Now, that probably looks quite scary. Like, you're probably looking at it thinking, oh my God, I don't know how I'm gonna, write anything like that, whatever have you, but don't worry, like, it's actually quite easy, and you've got quite a lot of time starting from now. And I'll tell you why, okay? So these are my application tips. Start your white space answers early, okay? Don't leave it for the last day. It takes quite some time to write, and you actually want it to make sense and readable, okay? But even more important than that is you literally now have a mark scheme of what you need to do from now to the end of December to get those marks. You know what they're looking for, right? So from now, sit down and make a plan on how you're gonna fulfill those things. Don't be unrealistic. You probably can't sit 3 PEDS exams from now until December, and it's not even worth it, because that would only give you 2 points anyway, right? So be realistic. Look at where you're strong and where you're weak. Look at where you can build on and what more you can do. Can you complete a QI project from now until December? Definitely. Can you complete an audit cycle from now until December? Definitely. Can you get involved in teaching, leading and management? Of course you can. There's a lot of things that you can do from now until then. You just have to be well planned, right? So you've got basically the steps of what you need to do. You just need to work towards that and make a plan that's specific to yourself. Now, it gets even easier, right? Because the Royal College of Paediatrics, they actually have a scoring framework that's available on their website for these questions. I'll show you all the resources towards the end of my my presentation. But the scoring framework literally is the mark scheme that the examiners, or not examiners, but the people looking, the people assessing you are going to be looking at to assess you. So you can look at the mark scheme and see where, if I did the application right now, what would I score, and how can I improve that, right? And you can work towards it. The second thing you should do, not only should you go through the scoring framework, you should also go through the person specification. This is basically a list of essential and desirable criteria for what they would want an ST1 to be, ST1 pediatrician to be, basically. So firstly, go through it, make sure you have all the essential criteria, so you pass long listing. Then after that, you go through it with the desirable criteria, and you see what you need to improve on, what you can add to, and this will be very, very helpful for both the application questions and the interview questions, Okay, so two very, very important resources, and I'll show you where to find that in a moment. Okay, so moving on, the next thing is the interviews. When I did it, there was online interviews, and it's been online, I think, since COVID. If I was to guess, I would think that they might actually continue the online format. Reason being, it works quite well, I guess, and probably easier to organize. But I don't imagine the interview process to change much. Before the online interviews, it used to be stations anyway, so I imagine it will stay similar. And they still want to know the same sort of things about you, so it's still good to prepare. And close to the time, especially by October, you will know what's happening. Okay. So what stations are the interviews made up of? One, there's a communication station, which is a role play. We'll get into that in a moment. Two, there's a reflective practice station. Three, there's a pediatric clinical reasoning question. And four, there's a station on career motivation. This is basically replacing the old portfolio station. It's more of a virtual portfolio. You're not actually presenting your portfolio, but you are your portfolio, more or less. Okay, so interview tip. So just my general tips. Look at the applicant guidance. There is a PDF also on the Royal College Pediatricians website. That's called SD1 Pediatric Applicant Guidance, right? Everything that I've shared, and even more, probably some questions that you might have, everything that you can think of with regards to pediatric application is on that PDF, right? Including guidance on each interview questions. Guys, it doesn't get any easier than this. They literally give you guidance on each interview question so you can actually prepare for it thoroughly and know what you're going about. Secondly, again, person specification. When you're going through each interview question and you're preparing for it, you've read the applicant guidance for that particular station, you then go over to the person specification, you look at which part of the person specification applies to this question, and you figure out how you can show that you are the person specifically good for this role, right? And then the other thing that I used that I found quite helpful was the general ISC medical interviews book. People use it across all specialties. It's really helpful. Just don't read the whole thing, like be very specific about what you're reading, but make sure that, because if you've already planned out each question, you know what would be like helpful. So when will a star, sort of answer would be helpful, when a camp answer will be helpful, etc., etc. So yeah, that's quite good. And practice genuinely does make perfect. If you can do some mock interview with friends, that'd be great. I did a mock interview with one of my friends who's like a pediatric ST2, like the day before my interview. I found it really, really helpful. So practice, do mock interviews, even if it's with family, really worth it. Okay, so that's like my general interview tip. Now, let's break it down to each station. The first station, communications. So this is going to be a role play. It will be an interaction between yourself and an actor. The actor will either be a patient, so a child, or a relative, like a parent or carer. And you'll either be asking to explain a clinical condition or reason for an intervention or transfer or something along those lines, right? So I know the year before last, it was, you were speaking to like a 14, or like a teenager, basically, like maybe it was a 15-year-old girl, and she had asthma. She came in with an asthma exacerbation, and you found out that she was smoking. So you had to speak with her. It was a bit of an ethical one, because she would ask you, are you going to tell my parents? And you have to know like all the ethical, stuff, like is she Gilead competent? Do I need to inform her parents, etc.? That kind of stuff. And also just trying to speak to her on a level and, try to persuade her to stop smoking, basically. And then my interview this year, I was speaking to a mum of a child who just came in with an anaphylaxis, and she was really upset. She was like saying, I'm gonna self-discharge, but the nurses were saying you need to have like an EpiPen to go home with, and she's like, I don't know what the hell that is. So I had to sort of deal with her concerns and explain to her what the EpiPen was, and it was more like empathy, like, oh, it must be very scary for you when you saw, your child going through this anaphylaxis, and all that kind of stuff. So it's all of that good, com skill, good med school kind of stuff. So that's something you can practice. That's something the scenarios you can come up with and practice. And then in terms of the marking, they have like a scoring framework, and they have negative and positive indicators. So you can be marked negatively if you do something that's sort of inappropriate. So that's something to remember. And then, so that's the communication station. So if we move on to the reflective practice station, now this station is a bit shorter. So you don't actually have that much time, and they actually expect you to explain a lot, right? So they asked me quite a few follow-up questions for this one, and they really dug into my answers. So what you'll basically be asked to do is you'll be asked to describe a particular clinical event that either went well or went badly, okay? And then you explain your role and your reflection on that event, okay? And then you need to talk about how this has developed your practice and how you now deal with these feelings in the future, okay? So with me, they sort of cut across me a few times. One thing they always tell you to do is do not spend a long time explaining the clinical event. It's literally redundant. Just explain it enough that you can then go straight into your reflection, right? So for my reflective practice, I was talking about something like an event that went well, and so I learned from whatever, and then they literally were like, okay, then what went badly or something like that. So just be prepared for that. And just remember, it's all about reflecting. This is what happened. This is how I learned from it. This is how in the future I have now interacted now since that incident. And then the last question as a follow-up that they will ask you is describe your use of daily what's the use of doing daily reflective practice, basically. So that's the question that they will ask. And that's when you can prepare for. Okay. So then the other one, the next station, clinical reasoning. So this will be a case-based scenario. You'll be given a case, basically. You'll be asked to do an assessment. You'll be asked about investigations and management. It's like a clinical OSCE type thing. They don't expect you to have like complex clinical knowledge, right? Because you're expected to know as much as an F2 might know. So don't think that you have to revise all of pediatrics. Like, don't do that. But what I would definitely do is revise acute things like acute asthma, anaphylaxis. My one was DKA. There's been status epilepticus before in the past. Yeah, so all of these things are things that you should how would you, and just don't forget your ATE. Like, just go into everything, ATE, and it's pediatrics, guys. Like, escalate as soon as you enter the room, more or less. Like, just escalate quickly. ATE, intervention as you find something going wrong, and then just work through it methodically as you would in OSCE or doctors. You know what you're doing. It's not going to be too deep, but just know the basic stuff very well. Okay, and it's the same thing marked with positive and negative indicators. And then lastly, career motivation. So this is the station where they ask you about yourself. This is like your virtual portfolio one. So this is the one where they ask you what makes you why a career in pediatrics. They ask you things like what makes a good pediatrician. They might ask you who's your role model in medicine and why. So this is basically your chance to make yourself shine, to show your personal attributes and achievements. I was asked what's the achievement that I'm most proud of. So have these type of things ready, and use your application answers. So they don't have using your application. Find the most interesting things that you would talk about, and just practice different questions they can ask you with regards to career motivation. There's quite a few examples in the ISC medical interviews book. Yeah, so that's what I would do for the career motivation. Now, the essential, I'm at the end now. So the essential resources, very, very important. So if you go to the Royal College of Paediatrics website, I've got a little screenshot here, and you go to education and careers, you will find specialty training level 1 application guidance. At the bottom of the page, you will find PDF links to 1, pediatric level 1 applicant guidance, vital, read all of it. 2, the person specification. 3, the application form scoring framework. And also there's a webinar on there from last October. They do a webinar every October. So watch out for it. This is when they will tell you everything about what the application will be like for the upcoming year. And it's your perfect time to ask questions. and they always upload the recording on YouTube, and so you can watch it back later as well. Last year's one is still there, so you can watch it again. You can watch it now just to, you know, warm yourself up. If I can do a new share, I can quickly scroll to the bottom of the website and show you guys how to find the resources. So if I quickly share that.
Huda, Jeeves is putting it in the chat for them, the resources.
Okay, okay. All right, brilliant. Okay, that's fine then. Yeah, so that's the end of my talk. Any questions?
Okay, thank you so much. Once I'm just putting my camera on. Thank you so much for that. That was so comprehensive. A lot of information. I'm sure everybody has a lot to take away from that. We'll do the Q&A at the end. So just everybody, any questions you can think of at the moment, you can just start putting them in the Slido. If you could stop screen sharing, I will then get Dr. Jeevahan to start her bit. But thank you so much. She literally was working fantastic today as well and still managed to find time for us. So thank you so much for that. Okay.
I think that was the world's best
that was fantastic
talk ever.
That was truly fantastic. Yeah. So what I will do is I'll start screen sharing for you. Okay, and then we'll get started with your bit. So Dr. Jeevahan is a current trainee. So her talk was going to focus more about what life is like as a current PEDS trainee, which I'm sure will also be very beneficial for those interested. Okay, bear with me just a second. Yeah. Okay. Oh, ignore my emails. Okay. You can go.
Hi, everybody. My name's Jeevana. I'm one of the pediatric ST1 doctors, and I'm currently working in Birmingham in a general pediatric centre. Firstly, I just want to say thank you, everybody, for being here. Thank you for showing interest in pediatrics. It's an amazing opportunity to talk about life as a pediatrician. I hope I do it justice. And please ask lots of questions at the end. It truly is such a special career. Next slide, please, Samir. So just a quick plan of what I want to talk to you about today. Huda has beautifully explained what to expect in the application process. So I want to give you a kind of realistic idea of what to expect when you hopefully do become a pediatrician. So I'll talk to you about the training program and then about the Progress Plus curriculum, which is a new curriculum coming in place next year. A little bit about subspecializing within pediatrics, about, unfortunately, the exams that you'll have to sit, and then the day-to-day life that you can expect as a pediatrician, and then some reflections of my time and my short career as a pediatrician. So moving on to the training program. So I'll only touch on this for a short time because this is the training program as it is, but next year it will be changing. So as it is, pediatrics, as I'm sure you're all aware, is an 8-year training program. It's currently split into 3 levels. So SD 1 to 3, and then 4 to 5, and then 6 to 8. At the end of each level, there's an ARCP panel whereby a board of consultants basically sit and discuss whether you've met your learning objectives and whether you're suitable to progress to the next year. Within the level 2 area, that's when you'll start thinking about subspecializing. Next slide. So the Progress Plus curriculum is essentially the same learning objectives, but it's now changing into a 2-level kind of system. So there's only level 1 pediatricians and level 2 pediatricians. Luckily for you all, it's now a 7-year training program, not 8. So it's not as long a slog, but it's, it is a really positive change, and they've made lots of changes to make it more kind of flexible for everybody. So previously you had to finish all of your exams by ST3, and now they've changed that to ST4. and you can start subspecializing from ST5 onwards. So START is essentially the kind of process by which you become a consultant. So in surgery, for example, some of you might know that you have to sit the FRCS. So it's a big kind of formal examination that you have to sit to become a consultant. In pediatrics, it's different. You sit your 4 exams at the beginning of your training, and then once you've hopefully passed those, you don't have to sit another formal examination. START is just a kind of list of objectives and feedback that you'll have to kind of go through, and then at the end of it, you'll be signed off and you become a consultant. So it's as easy as that. Next slide. So just a quick bit about subspecializing within pediatrics. Some of you may be aware that, you know, you've always wanted to be a pediatric cardiologist. Some of you will only know when you actually start, you know, getting experience in the field. So I just wanted to explain the 2 kind of entities to you. So you've got GRID and SPIN. GRID is your kind of, it's the trainees that are purely subspecializing. So they've left general pediatrics, they're going totally into neonatology or cardiology or respiratory or palliative medicine. So you no longer do your general pediatric on-calls. SPIN, for example, is for those of you that want to continue general pediatrics and want to kind of still do those on calls, but take a subspecialty interest in cardiology or respiratory. So for example, your consultant week may look like, you do a few general pediatric on calls, and then you do a diabetes clinic at the end of the week because you have a subspecialty in endocrinology. So it's a really, really flexible program, and it gives you, you know, the chance to really branch out and start thinking about it early. But just a note here that GRID, so to become a pure subspecialist in something, is a lot more competitive than SPIN. And if you do know that you want to start, you know, thinking about subspecializing in something, it's good to start getting experience and taster weeks in that early. So right from the beginning of ST1, because the process is quite difficult. So moving on, the exams, so unfortunately every specialty you have to do your exams. Sorry. There are 4 of them in pediatrics. There are 3 theory ones and then 1 practical one. Huda explained that you now get points. You never used to, but you now get points for doing exams in your foundation training before you start applying. So if any of you have the time and are eager, you can, but remember not to stress about it because it's only 1 or 2 points. It's not going to be the make or break of your application. So your 3 theory exams, you got 1A, which is foundation of practice. For me, that felt a bit like an extension of my pediatric knowledge that I'd acquired from medical school. It wasn't anything mind-blowing. It does require revision, but it was useful for me to sit it shortly after medical school because I felt that, you know, I still had some of that knowledge. 1B is really sciencey. So it's all, you know, biochemistry, pathophysiology, Krebs cycle stuff, you know, all that stuff that is, you know, pretty tricky and requires a lot of time and revision. This is the exam that usually slips people up, but not to worry, all of us do it. All the consultants have done it. You know, there are some really good resources out there. And if you want to get in touch about advice in terms of how to get through these exams, I'm happy to give you some later. Part 2 is your applied knowledge of practice. So that's another theory exam, but it's much more clinical based. So it's a lot more useful to your daily practice. It's like history, examination, differential diagnosis, management kind of style questions. And then your last kind of clinical OSCE is your MRC-PCH clinical exam. And once you've completed that, you are then officially a pediatric registrar and you have fully kind of acquired the MRC-PCH qualification, which is pretty cool. So those 3 theory exams you need to have completed by ST3. And that practical exam you need to have completed by ST4 to progress on to ST5. So start thinking about them early. You can retake each one, I think, up to 6 times. I hope it doesn't come to that, but there it is. So moving on, I wanted to talk to you about the day-to-day, that's what I was here to talk to you about, wasn't it? I'm just faffing here. I wanted to talk to you about the day-to-day life of what we do in pediatrics. As you can imagine, it varies massively depending on which area of pediatrics you're in. If you were in neonatology, this would be very different. First warning in pediatrics is that there are loads of handovers. In a 24-hour cycle, you're probably going to have at least 4 handovers. So a normal day in my life, if I have a long day on call, after about 17 alarms, I will eventually wake up, have a large cup of coffee, do a bit of yoga, and then get to work. We meet the night team, and they tell us about any sick patients that have come in the night, kids that we need to be aware of going forwards in the day, and then we often get a bit of teaching. So Peds is brilliant for teaching. There's loads of opportunities to learn and, you know, have access to education. So we'll get about 30 minutes to an hour of teaching from a consultant or a reg, and then you go and do your ward round, and you see every pediatric patient in the ward, including those that are under other specialities, including, you know, surgery and orthopedics. So for example, you're going to see all the children that are query appendicitis, the ones that have a femur fracture, etc. Then you come back, and you can call it whatever you like. We call it a huddle, and you kind of speak about the main things that have come out of ward round, and you discuss any patient safety issues. There's always snacks involved, and then you get on and do your jobs. You eat something, do more jobs, and then at around 4:30 you'll hand back to your evening team, and the short day people will leave. The evening tends to be hectic because you're lower on staffing. So, you know, it's quite a busy time of the day. And then at 8:30, you hand over to your night team, and you get back home, and you know, relax, put your feet up, have a cup of tea, do whatever you do. So yeah, I wanted to talk to you, next slide, please. I wanted to talk to you a bit about the jobs part of it. So obviously I've just said, you know, you go away and do jobs. I really want to stress to you just how varied pediatrics is. I mean, I think it's so unique in that you can just be involved with absolutely everything. I mean, our pediatric SHOs at the moment, even our F1s and F2s, they get involved with loads of stuff. So, you know, your day job might be, you know, you're doing bloods and cannulas, you might learn how to do a lumbar puncture. If you're holding the on-call bleep, you're attending alert calls in A&E, going to see ambulance alerts with sick kids, resuscitating babies and children, lots and lots of family discussions, whether that be kind of reassuring worried parents or dealing with a complaint, lots of TTOs and discharge letters, unfortunately, too. You might be speaking and doing lots of S-bars to tertiary centres. You might have time to play a bit of hide and seek with some of the kids on the ward. There's lots of safeguarding, so you can, you know, if you are interested in that, a lot of people aren't, but if you are, you can really get involved with it and see how the system works. You know, spend time with social workers, the police, attend these strategy meetings, and you know, do your part in safeguarding children. And in neonates, I just wanted to put a line in there because it's just so kind of clinical procedure heavy. So less admin, more clinical procedures. You'd be amazed at the kind of things that you'll learn how to do in your very first year of training. You know, you'll be resuscitating babies the size of your hand, putting in central lines, intubating them, putting in catheters through their umbilical cords. It really is just amazing. So as my last slide, I wanted to talk about, you know, just to bring the kind of talk to a close, I wanted to talk about reflections that I've had in my first year of pediatrics, and things I would have told myself if I was in your position. So I think Peds is often missold, unfortunately, and a lot of things I repeatedly was told that, you know, oh, you're not just dealing with the child, but you're dealing with the auntie and the uncle and the grandma and the 2 parents, and it was just, you know, so annoying, I don't want to deal with it. But I think people often forget that difficult parents, or parents that are rude or frustrated, 9 out of 10 times they're only worried because they're scared and they're vulnerable, and their child is the most important thing in the world to them. And I think we need to remember that we're incredibly lucky to be in a position where we can be there for them and support them in a time that might be one of the most difficult times of their lives. Point two, that the variety is crazy. I mean, I've spoken to you about it before, but you really can, within an 8-hour shift, be at neonatal delivery, at C-section, resuscitating a 25-week gestation baby, then going to A&E and seeing a teenager who's had a massive overdose of paracetamol and is unconscious, then going back to the ward and, I don't know, blowing bubbles with a toddler, and then being called back to A&E because you have a septic infant who needs, a cardiac resuscitation. And, that can all happen within such a short period of time. And it is just so varied and so fun and exciting. A wonderful thing that is very unique also to pediatrics is that children really do bounce back. I mean, you'll be there on Monday morning thinking this kid is not going to make it. And then the next day you walk in and walk around and they're just, playing on their PS4, just acting like nothing's happened. And it is just amazing to see. You get to work with some really amazing people and like-minded people who are kind, supportive, fun, lighthearted. I think one great thing about pediatrics is every day I meet somebody that I'm inspired by, and I think that's a pretty cool environment to be in. Yes, there will be difficult days. Pediatrics can be extremely sad, and there are some really heartbreaking cases, whether it be safeguarding or children that have passed away. But it's big effort, big reward in pediatrics. One thing that's comforted me and got me through difficult times like that is in knowing that in that time, at the end of a child's life or a baby's life, if I have given my all and offered the best possible care to that family and that patient, I can at least take some comfort in that. And that, those cases are, 1 in 100. You're going to see one really sad case and 99 amazing, cute, hilarious kids that make your day. Don't take yourself too seriously. Yes, be professional and respectful at all times, but which other specialty is play a part of your literal job specification? It's such a fun environment to be in, so really get yourself into it. And my last point is just that, yes, pediatrics is fun, it's great, but also it is a huge privilege to be able to look after children, prevent complications in chronic disease, and give them the best chance at a better life in the future. I think that's a huge privilege, and it shouldn't be underestimated. So it is the best specialty in the world. And I'll leave it to Simone now so you can ask some questions. Thank you, everybody. Oh, that's my email there if you wanted to send me any questions in terms of the application process. Actually, Huda will be much better for that. The process has changed since I've applied, but in terms of exams or any questions that you have with career advice or any questions that any doubts that you might have, just feel free.
Okay, thank you. Sincerely. One thing that I can say is I have known Dr. Jivahan for about a decade. We went to med school together, and to see her passion from med school for pediatrics and for her to develop into the doctor that she is today is just, I feel honored. And I also feel like I should change my career right now. I'm that inspired. Genuinely, I may have to leave the dark room. So guys, please, as Dr. Khalif as well, she's kindly put her email as well in the chat. If you could guys, just take a minute, put in your questions, and then we'll get started. I am so impressed by both of you. Phenomenal. And you guys are such an asset to your career. Genuinely. I'm really touched. Okay, so but yeah,
I mean, I've not started the career yet, so I might
no,
be honest,
listen,
so we give up to Jeeves.
I was with you at work today. So I'm testing as well. So you too, honestly, for sure. But yeah, guys, if you have any questions, Slido is active right now, so you can ask any questions. If you don't, it's okay as well, because I mean, they've covered so much. In terms of the questions, I know someone's raising their hand. If you could just either put it in the chat, just because we're recording this, so I don't just, if you just put it in the chat or use a Slido link, I'll just repost it again. I'm just going to repost a Slido link just one more time for people. Or post any of your questions in the chat is open as well. Okay. So you can use that link for Slido, and the participation code is here as well. Oops, sorry, I just put that twice. 1 second. Three, 2, 3, 0, 4, 9, 0. Okay, yeah, and that's the code. All right, I'm just going to see if any questions. And I agree, it is very fun from seeing it from the outside. Okay, so first thing that I'll just comment that I've seen is that there's a massive thanks to both of you, that it was really amazing. So thank you both.
Thank you.
So one question that we've got here is, what is the stress life and lifestyle like as a pediatrician?
I will go ahead and try and answer that. Okay, so firstly, I probably didn't say it in my talk because I was trying to stress how great it is. But pediatrics is stressful. It is busy. The rotas are hard. They're strenuous. The on-calls are heavy, and the rotas are often understaffed. And all of that is true. You'll hear it multiple times, and then all of us, still blindly go into the speciality anyway because it's so good. But yes, it is stressful. I think you need to be aware of that right from the get-go and have mechanisms to look after yourself. I found the first 6 months pretty heavy. I'd done a full year, full time of F3ing, and then after 6 months of ST1, I knew that it was too much for me, so I dropped down to 80%. Not many people do that so early on, but there's no shame in it. It gives you 1 day off a week, and you need to do things that look after your well-being, because otherwise burnout is real, and we're coming out of the pandemic and things have been pretty difficult. So yes, it is stressful, but some kid has made me smile every day and made it worth it. It's just kind of making sure that you take control of your life outside of work. Make sure that your rota is safe. Make sure that you're on it with your rota coordinator for annual leave. Less than full time is easy. You can knock back hours without any stress. Just make sure you look after yourself and know the signs when you're struggling a bit.
Thank you so much. Dr. Khalif, I think the next question should be for you. So the question is, can you hear me okay?
1 second, Sumaya. I was just going to say, I was just going to say that you can drop down to 80% from the start. So I'm starting on 80% because I just don't have that much energy.
No, that's excellent, Adin. Okay, so the next question is, for the person specification, if you have multiple pieces of evidence for a certain aspect that would score an equal number of points, should you list all of them?
No. So in the mark scheme, it actually tells you, it will say if you've got one, for example, if you've only done one audit, you might get only 1 or 2 marks. If you've done more than one, or you might get this many marks. So it actually tells you in the actual mark scheme, if you've got 5 things to say, but you're not reflecting on them and you're not saying what you've learned from them, then you're just wasting your application space, basically. So what I would do is look at the actual mark scheme, look at how many is a minimum number that will give you the maximum points, and then stick to that. and just have space to talk about what you've actually learned from each thing.
Excellent, thank you. And for either of you, whoever wants to answer this question, so are there any specific character traits and attributes needed for a career in peds?
Jeeves, I don't know if you want to answer this.
I think she's frozen, so I think it's
frozen.
Yeah.
Character traits. Yeah, I mean, they sort of, I remember they asked this question in the interview, and I think you can swing most positive sounding character traits to, you know, needing that in peds. So things like being a really good team worker and good at communication, that's something that's really important in peds, because you're working in a really big multidisciplinary team, and often you're working with social workers and other statutory organizations. And also on top of that, you're going to be speaking to kids, so that's different than speaking to adult patients. So you need to, you know, be able to communicate with children and also with their parents, sometimes at the same time. So I think like something I highlighted in my interview was an experience that I had, different experiences that I had, which meant that I had experience working with children, I had experience working with parents, and I had experience doing like a simulation where I was looking after a sick child and had to explain to the parent at the same time as looking after the sick child. So those are the kind of things that I think are different for pediatrics in general. But then all the other things that are important in most specialties also comes into play. So for example, even if you've not done, I hadn't actually done a pediatric rotation in my foundation years, but I had done taster weeks. But wherever I could swing my way, I swung my way. So because I did a ITU rotation anesthetics, I had done a lot of intubations and arterial lines and things like that, basically, and PICC lines. So I swung that, I spoke about that and talked about how dexterity is important for doing lumbar punctures in kids and blah, blah, blah. So all of these things are often things that you can swing over. So all the general stuff, time management, you know, dealing with stress well, all that kind of stuff. Yeah. Did I answer the question? I think I did.
Yes, you did. And I think also Dr. Jiva is just joining us again. I think she just had a bit of an internet. I'll come back to that question. Just another question for you, Dr. Khalif. So does being less than full-time lengthen your training?
So yes and no, right? So now because we're moving to the more competency-based sort of training program, and it's been cut down to 7 years, if, say, for example, you're doing your training at 80%, but you're showing that you're meeting all your competencies, you can move from the next level as you would normally, but you have to be able to prove that you're meeting all your competencies. If you're not, then it will take a bit longer. You do have less time at work compared to your other colleagues, so you have to be more on the ball, I guess. But I guess the less you're working, so when you get down to 60%, 40%, those kind of things would eventually, I think, lengthen your training a little bit. Yeah.
Okay, thank you. Dr. Jivahan, can you hear me okay?
Yep.
Yeah, got one question for you as well. I'll also Dr. Khalif as well this. So are there any specific character traits or attributes needed for a career in peds?
Yes, I think. Firstly, preferably you like children. I think one of the main things I've found is that you really need to be a good communicator. You know, you don't need to be solid by the time you start training, but I think you need to be somebody who enjoys communicating pretty much throughout your career. Even if you do kind of community pediatrics or something that's less team-based, you're always going to be having very difficult communication scenarios. So I think, you know, somebody who takes pride in their communication, somebody who enjoys communication, I think that's very important. Somebody who's compassionate. I think you need an abundance of patience to be in pediatrics. Some parts of it are really frustrating, and families can be, you know, really trying sometimes and test your patience, but you just need to always think back to why you're doing it. The fact that you're there for the child and not anything else. So I think compassion, good communicator, enjoys children, likes, you know, hanging out with children. And Huda, anything else?
Yeah, I think she already had a go.
Oh, okay.
Yeah. So no, but thank you so much. One other question. This is so does having like recommendations from other like consultants from the field increase your points or chances of getting into peds, like letters of recommendation? That's not really what a UK system, but what do you think?
No, yeah, no, it wouldn't. The only thing knowing people might help you with is getting audits done and like getting involved with teaching and presenting. So if you've presented something like at a big conference, you get points for that or whatever have you. But no, Les, you do have to input some references, but I think that's just to make sure you're not like, you know, a criminal or something.
Yeah, no, exactly.
Yeah.
No, I think that's very much like an American system where they've got like letters of recommendation, but we don't do that here. We've got references, but that's just, as Huda said, just to make sure that you're an okay person and doesn't have any big red flags. But yeah, I think the last comment is just, again, a massive thank you to the speakers. But we've gone through all of the questions. Thank you both sincerely. And thank you to all those who've attended and showed an interest in pediatrics. So we'll end the call there. Thank you so much.
Thank you.
Thank you, everyone.
Bye.